Does anyone know anyone who's ever been sick? Who's ever not been sick or never ever gotten sick in their lives? Well, the inevitability of life are two things: death and taxes. And what comes with that is going to be sickness and illness. Today, 45 million people in America are uninsured, which is astonishing out of 300 million people in the United States of America. Some of those can be reported because they're illegal immigrants, of course. Today, we're going to talk about universal health care and what benefits the universal health care system has for the United States. Everybody aspires to affordable home, a secure job, a better living standards, reliable health care, and decent pension. My generation took those things for granted, so should future generations. Jeremy Corbyn. This basically states that he would rather continue taking for granted and having all those benefits that he can pass on to his children and his children's children. Today, the healthcare system is in shambles. Elevated administrative costs, pharmaceutical costs, and even the government insurance costs. Today, the United States should adopt universal health care because it provides lower health care costs, lower administrative costs, and lower drug costs. The United States spent $5,600 per person in the United States of America every single year. Now let's compare that to France, who has universal health care, and the problem with this. In France, $23,000 is the cost of a cardiac bypass surgery. In the United States, it's $73,000. And you wonder why these costs are so high. We're going to go over that. So let's start off with tax-funded coverage. The U.S. government, and this is according to a Harvard study, the U.S. government, that $5,600 that we pay in taxes actually goes to what's called tax fund coverage. It covers public employees, veterans, and the military alike. This is according to a Harvard study. What that means is basically when you pay taxes, your tax fund is going to support these entities here. And this includes the President of the United States, Congress, Senate, and other public officials. So you're actually paying for their health care. And what you get in return from that is absolutely nothing. So even if you have a job and no health insurance right now, you're not gaining any benefit whatsoever from that. So this is why one main reason that universal health care should be implemented. You're already paying for it, but you don't see any benefits of it whatsoever. The solution to this is the tax fund distributed to all Americans, just as I stated before. If we have a flat tax where everyone is income taxed and everyone pays into the system, everyone can get treated without people falling through the cracks. The next problem we're going to talk about is we're going to talk about administrative costs. Most people don't really think about this. Now, administrative costs are basically all the medical billing, paying for staff, and other incidences such as healthcare IT, electronic medical records, things like that. Well, we're going to take a look at a few things. The hospitals in the United States, their 25% of their cost comes from these administrative costs. And this is according to the American Hospital Association in 2001, that all that paperwork, when a nurse documents, doctor documents, and nurse practitioner documents, basically every time they see a patient for an hour, they're doing 30 minutes of paperwork. So if someone's in the hospital for 3 days, you're talking about 72 hours. Now you're talking about hours of paperwork that these providers have to spend on instead of actually taking care of their patients and providing high-quality health care. The solution for administrative cost is universal health care. And basically, from these statistics here, reducing the cost would actually save $158 billion compared to what Canada's administrative costs are. And to further illustrate this, Medicare, which is our own personal single-payer program that's ran by the government, they pay 1/6 of the cost that private insurers and hospitals pay in administrative costs. 1/6. Now we'll just talk about the prescription problem. Besides the lowering government costs and lowering administrative costs, we have a prescription drug problem. So, on average, the United States versus Canada, who has a universal healthcare system, a single-payer system, they pay half of what we pay for medications. Now, these medications aren't different. They're the exact same medications that we buy today. So if you go buy Ambien to help you sleep, the Ambien is the exact same Ambien, exact same corporation that's distributing it. For some reason, it's half the cost, and we'll go over why. The major reason for the Kongen Lage is the generic drug problem. So actually, drug companies, they pay distributors not to market generic drugs, and they pay the pharmacists not to market prescription drugs to civilians. So when you go to the pharmacist and your doctor gives you a prescription, the first drug that they're going to give you is they're going to give you the name brand one, which costs more. Okay? And the reason they do that is because it's going to better fund the pharmaceutical company, and the pharmacists, on the other end, are getting kickbacks from them. There have been many lawsuits about this, but there's nothing that's been availed from it because it's a private corporation and they're able to do what they want. So they pass that cost on over that the Canadians are saving. They're passing all those costs over to us. Now, Medicare within itself is the biggest medication buyer. And the problem with this is that Medicare is not allowed to negotiate drug prices with the pharmaceutical companies. It is in their contract. Now, the solution to this is that when we look at the different European countries that are out there right now, the government actually sets their drug prices for those corporations. So with all the conglomerates like Merck and Pfizer, they're distributed throughout the world. So there's only a handful of pharmaceutical companies. Yet when those drugs reach Europe, you're going to see that the government takes over and says, hey, you're not going to charge this amount of prices for anything. Now, with that said, with our single-payer system like Medicare, if Medicare was able to actually negotiate those drug prices, they would lower their drug prices also. Now, if we had a universal system and the government was running it, then we'll be able to lower that cost even further. The next entity would be stop Americans from subsidizing the pharmaceutical companies, because basically we're paying taxes and we're paying for all these high brand medications, and these high brand medications where they're costing us $300 versus $150 for Canada and European single payer systems, they're taking that profit and they're redistributing it back into their own coffers. So in conclusion, the universal health care will lower costs of procedures by 31%. It will bring down administrative costs by 1/6 of private insurance costs. And furthermore, pharmaceutical companies lower their drug prices through regulation and from government. The United States should adopt universal health care because it provides lower health care costs for administrative costs also. When we're going back and speaking about the benefits or what costs the government, you can also be referred to David Singer. He's an economist who's provided the studies that we're talking about today, and Emily Miller. She's also someone who provided the information for prescription drug